Alright, my name is Tony DeBose, and I'm doing celiac disease as my gastrointestinal disease. So, pathophysiology of celiac disease is it's an immune reaction to eating gluten. So, gluten is a protein that's found in wheat, rye, and barley. So, if someone has celiac disease and they eat gluten, what happens is gluten triggers an immune response in your small intestine. Over time, you may not notice it at first, but over time, this can damage your small intestine lining. And if that is damaged, it prevents nutrients from being absorbed, so malabsorption. With the intestinal damage, it can often cause common symptoms of a gastritic disease such as weight loss, fatigue, diarrhea, bloating, and there can be serious complications that may need surgery or may need treatment for a longer period of time. And in children, malabsorption, it can affect their growth and development if they do have it, and then also the symptoms as well that are seen in adults. Diagnostic testing that is used for a patient is it is hereditary celiac disease. So genetic testing is one testing that they do to look for human leukocyte antigens. And then also serology testing is normally the main one. It looks for antibodies in the blood. If there are elevated levels of antibodies in the blood, this will then show an indication of immune reaction to gluten. It is possible that if you haven't eaten gluten in a long time, that if you haven't and you go get tested, it may appear normal. So they ask that if you eat gluten beforehand and then get tested to get those accurate results. Also, an endoscopy can be performed, an endoscopy and a capsule endoscopy. So an endoscopy is it's a long tube that's put down the mouth and passed down to your throat. It looks at the upper GI, and it can help your doctor look at the small intestine, but also take a small biopsy of that small intestine to analyze the damage on it. A capsule endoscopy is exactly what it sounds like. It's a capsule probably the size of a vitamin that you swallow, and it has a little camera on it. Once you swallow it, it'll travel through the digestive tract, and the camera will take thousands of pictures and is then transmitted to a recorder for your provider to review. Clinical manifestations, symptoms of this disease, as I stated before, are the diarrhea, fatigue, abdominal pain, nausea, vomiting, and of course constipation. However, if celiac disease in adults doesn't always have to be symptoms of gastro. It can also be itchiness, mouth ulcers, loss of bone density, anemia, so iron deficiency, joint pain, and headache and fatigue is a common symptom as well. For providers, when they treat for celiac disease, the main treatment for it is to have the patient on a strict gluten-free diet. Because gluten-free is found in so many products, sometimes the provider will order the patient to see a dietitian. For a dietitian, like my mom has celiac disease, so most of gluten, we don't eat gluten, but gluten such as barley, gram flour, malt, rye, any form of wheat is gluten, and kind of teaching your patient the do's and don'ts of gluten, but also that gluten can be hidden in different foods, medications, and non-food products. So educating them on it can be hidden in modified food starch, vitamins, mineral supplements, lipstick products, toothpaste, envelopes, stamps, prescription over-the-counter medications. This is something that a dietitian will go over with the patient, but also as a nurse you can teach them about what to avoid and what to mostly eat. Once you educate them on why removing gluten is important, removing gluten from the diet, it'll gradually reduce that inflammation in their small intestine, causing them to feel better and eventually heal altogether. Some complications of the celiac disease, if it's not treated, it can be lymphoma. Lymphoma is a cancer of the intestinal lymph system. It is very uncommon to get this disease or type of cancer, but avoiding gluten can help prevent this complication because it can happen. Skin conditions, rashes. You can get rashes really anywhere, and they can be itchy, raised, fluid-filled, almost like blisters. I know that was my mom's first sign, was having a rash on her arms. So that is kind of a sign to go get treated or avoid gluten. So nursing plan of care, if a patient came in to the office or hospital and they were complaining of different symptoms such as you may have like a swollen belly, constipation, gas, chronic diarrhea. If that were the case, then we would have the physician order imaging on the patient and blood tests on the patient, possibly looking for any gastro disease, but mainly looking at celiac disease if they stated it only happens when they eat certain types of food like gluten. If that was the case and they had their lab results, then we would, as a nurse, assess their mouth and skin, assess their abdomen, monitor their labs, diagnostic tests, assess for growth and development milestones, listen for any hyperactive bowel sounds, and administer medications and supplements as required by the physician and ordered by the physician. The nursing diagnosis using NANDA is for celiac disease is diarrhea related to intestinal inflammation secondary to celiac disease, as evidenced by watery stool, increased urgency to defecate, and abdominal pain with hyperactive bowel sounds. Planning to basically teach the patient what celiac disease is and how to treat it, explaining to them that help them understand to read food labels and possible trigger foods such as gluten. As stated before, you can recommend them keeping a diet log to help them determine what triggers them when they feel sick. Also teaching them that gluten may be in non-food items as well. Implementing to the patient that a strict food diet needs to be done. If the physician ordered a dietitian to meet with the patient, then have them go over that with them and create a diet with them. If the patient follows this diet, removes gluten completely, then evaluating them, they should be healing from it, no signs and symptoms of any celiac disease or gluten, and monitoring their diet as well, seeing their gastro doctor every month, and overall have no pain or diarrhea, constipation, and they're able to use the restroom and have bowel movements regularly.